Good afternoon, everyone. Hi. I'm Aditi Davray, Director of Learning Services here at Philanthropy New York, so welcome to this afternoon's program. So glad to have you. The value philanthropy consultant brings to foundations, that's great, and brought you in collaboration with the National Network of Consultants to Grant Makers. So welcome again. So a couple of housekeeping notes. You'll have, we have a live stream audience, so that's why I'm speaking into the microphone. Please pass the microphones down this end of the table. There's one here, and I'm going to leave this one down there. Please announce yourself before you ask the question so everybody knows who's speaking. And with that, I would now like to turn over to Paul Sturm, the Executive Director of the National Network of Consultant to Grant Makers, to lead today's session. So thank you very much, and welcome. Paul, over to you.
Thank you, Aditi. It is just a pleasure to be here at Philanthropy New York today, and really a thrill to see so many of you turn out to be with us in person. I know others of you are watching on the live stream, so welcome to all of you as well. When Philanthropy New York asked us to put this program together, we were very excited because it's an opportunity to share with you something that we really believe is groundbreaking in the field of philanthropy. Now, just in case you're not familiar with NNCG, we're a mission-driven organization. Our mission is to strengthen philanthropy and enhance its effectiveness across the United States and beyond. As many of you know, about a year or so ago, the Foundation Review, the journal that comes out of the Johnson Center for Philanthropy at Grand Valley State University, asked NNCG to co-edit an issue it was planning, and it's a special issue, and it's the first issue ever, or the first publication of its kind, ever focusing on philanthropy consulting. So we've just been thrilled over the last year to have the chance to do that. The hard copy came out about a month ago. Here it is, and it's also available online, and every article in the issue is open source, meaning you can download it and read it at no cost. So we're very pleased about that as well. The lead article in the Foundation Review is all about a special survey, or part of a survey done by the Foundation Center, which looked at the current state of philanthropy consulting, and what they did is they surveyed many grant makers. So you're going to hear much more about that in a moment. What we're doing here today is we're going to be sharing some of the content, some of the results of that survey with you, but just as importantly, maybe even more importantly, engaging all of you, we hope, in a conversation about what does this mean? What does it mean for philanthropy consulting? Even more importantly, what does it mean for philanthropy and civil society as a whole? So again, we're just really thrilled that all of you can be with us today. And what we want to do, before I introduce our very distinguished panel, is give each of you a chance to very briefly let us and everyone in the room know who you are. So starting to my right at the end of the table, you'll see a microphone. If you can just briefly share with us your name and affiliation, pass it down to the next person. We'll all know who's in the room.
Yvonne Moore with the Daphne Foundation.
Vivian Hexter, founder and president, Hexter Executive Consulting.
Kelly Hunt, just left the New York State Health Foundation to start my own consulting group.
Hi, Deborah Flood with Penn Flood Consulting.
Molly Penn with Penn Flood Consulting.
David Hindi, independent consultant.
We're going to go diagonally across. I believe there's a microphone at that end of the room as well.
Richard Mittenfeld, CCC Group.
Barbara Krasny Plows.
I'm Elizabeth Weiner with Arabella Advisors.
Katie Lamberger with Community Resource Exchange.
Thaler Picard Partners, Communications Consultant.
Barbara Greenberg, the Philanthropic Group and Levitt Foundation.
Mafruza Khan Advisory Services.
Dara Major, Philanthropy Consulting, and a proud member of NNCG's Steering Committee. Thrilled to be here with you all.
Great, thanks to each of you, and we look forward to your involvement in today's conversation after we hear from our very distinguished panel members. And to kick off our panel, let me introduce Brenda Henry Sanchez, who is with the Foundation Center. She is the Director of Research for Special Projects at the Center. Before that, she was with she was a Senior Program Officer at the Robert Wood Johnson Foundation in New Jersey. Brenda?
Thanks, Paul. Good afternoon, everyone. Okay, you know we were in the post-lunch crowd. Exactly, that's what we should have served instead of water to everybody. Good afternoon, everyone. Thank you. There is coffee out there. Okay, we should have directed everybody through that room first. I need to time myself to make sure that I keep on time, because we want to make sure that we get to these two women that are on both of my side, but even more importantly, as Paul said, to open this up for discussion. So I'm here today really representing my co-authors who submitted this paper that was published, as Paul said, in the special issue of the Foundation Review focused on philanthropy consulting in the field. And I'm just going to provide a high-level overview of the findings in our paper, because you can get much down deep and dirty into the results in the paper itself. So I'm not going to give you a word-by-word overview of what we found. And then also what we did was we did some analyses to look to see whether or not there were any different patterns in philanthropy consulting practice within New York foundations. And so I'll just highlight a little bit of that as well. Just a little bit of background, as Paul said, NNCG partnered with the Foundation Review to do this special issue, and really reached out to us at Foundation Center to see whether or not there would be an opportunity for us to answer the broad question, which is pretty basic. To what extent do foundations engage consultants in their work? For those of you who are either consultants or are foundation representatives in the room, you know that consultants are a critical and essential, aspect of the philanthropic ecosystem, but we've never really had an answer that told us to what extent consultants really do engage in the work of philanthropy. And so we just sought out to answer this very simple question: to what extent can we understand quantitatively what we think we know anecdotally or have known anecdotally in the field? And for the purposes of our paper, what we focused specifically on as it pertained to philanthropy consulting was consulting that focused on assisting foundations with overall governance, with program development, as well as management. We purposefully excluded consulting related to accounting, financial investments, and legal services, because we felt that was pretty common and frequent within the practice. And we also excluded consulting directly to grantees, providing technical assistance support to grantees. So this really was about looking at consulting foundations that engage consultants to support their overall work. Just so that we can get the data methodology out of the way for those of you in the room who will want to have a conversation with me later, I need to caveat it all, right? So what we did was we used Foundation Center's Giving Forecast Survey that we field every single year to try to understand giving trends in philanthropy. We always issue a special supplement as part of our Giving Forecast Survey just to understand special topics and trends. The survey is both administered web-based as well as paper to the field. It was fielded between the end of 2013 and the first quarter of last year. We invited over 5,000 foundations. The 5,000 foundations were staffed, and the people that were invited usually tended to be senior staff within the foundation. And we focused explicitly on foundations that had at least $100,000 or more in annual giving. And what we have to report on is responses from over 1,000 foundations that answered the survey. That's a little over 23% of those that we invited responded to the survey. And what we did was we weighted our responses based on foundation size, type of foundation, as well as non-response, not to give a national representative picture of philanthropy consulting practice, but more so that we can approximate what the practice looks like if those that responded to the survey look like the broader foundation sector overall. All right, so overall what we found in the national survey was that about a third of the foundations that responded said that they had, yes, indeed, engaged a consultant in their work within the last 2 years. However, what we did see was that there were major differences in the extent to which foundations engage consultants, both by foundation size as well as foundation type. Now, to the left of the chart, what you'll see in the yellow is we broke down foundations by giving, annual giving, and we'll see that for foundations that have giving of $50 million or more, over 80% of them reported having used a consultant, whereas the smaller foundations, those that gave $1 million or less, used consultants just over a quarter of the time, or at least a quarter of that group used consultants. And then similarly, in terms of foundation type, we see that community foundations, over 3/4 of them had reported having used consultants in the last 2 years, whereas the corporate and independent foundations hadn't reported using consultants in their work in the last 2 years. And just so that I make a note, independent includes both private and family foundations in there, so that's where those foundations are grouped. And before I continue, I just want to say if anybody has any clarifying questions on what it is that I'm covering, please feel free to raise your hand. Any substantive discussion questions, I would just ask for you to reserve them till the end. And just so that you also know, when we looked at foundations in New York State that responded to the survey, there were about 128 foundations based in New York that responded to the survey. We saw the same type of pattern of foundation engagement and consulting, both in terms of overall frequency as well as by type and by size. So no major differences with the New York funders when we compare them to national. Now, before I get into exactly why foundations use consultants, for those foundations that said they didn't use a consultant in the past 2 years, we asked them, well, why not? You know, why didn't you engage? And, you know, lo and behold, the reason why they didn't engage is because they didn't need a consultant. You know, pretty much over 3/4 of them said, yeah, I know, it's kind of one of those no-brainers, but, you know, it's kind of nice when data confirms what you think you already know. So over 3/4 of the group said, we just, you know, don't need the consulting support right at this point in time. We did ask additional reasons, and one of the additional reasons that was included for why a foundation would not engage a consultant was, well, a foundation policy or our procedures don't allow for it. And one of the areas that we found different between the national sample and the New York-based funders is that New York-based funders were more likely to cite procedures or policy as a reason not to have engaged consultants in the last 2 years, which we found interesting. All right, so to kind of go back to the group that actually engaged consultants, we asked them, well, for what purposes were you using consultants to support your work? And the 3 most common areas reported were for information technology, for communications marketing support, and for evaluation. These were the top 3. When we looked at New York State based foundations, information technology and communications marketing were still the number 1 and number 2 for New York-based funders. Number 3, however, was for New York State foundations was grants management. That was the 3rd most cited reason why New York State-based funders engage consultants in their work. We also asked foundations, well, you know, we know the areas that you use consultants for, but why? Why even get somebody else from outside of the foundation to support your work? And the overwhelming reason was to take advantage of outside expertise, knowledge, and/or networks that don't currently exist within the foundation staff. And other reasons that funders cited for engaging experts was the desire to have a neutral perspective inform their work, that there's limited staff capacity and the work that needs to be done, they need to have additional consultants to support their work. Also not wanting to add additional overhead or additional staff to the foundation were reasons why funders cited. using consultants. And when we looked at this question based on the New York funders, one of the interesting things that emerged was, some of the funders cited the need to have outside credibility as a reason to use consultants. However, New York funders were not as likely to cite that as a reason, okay? 10% of the national sample said, we want outside credibility. That's why we engage consultants, as opposed to only 2% of New York-based funders saying that they want outside credibility to help support their work. So how did these funders identify these consultants in the first place? Well, surprise, surprise, over half of the funders in the study said that the consultants that they found were consultants that they had worked with in the past, okay? They were consultants that were already in their network. The next most common reasons were based on network. Either grant maker referred the consultant to them, or a board member referred the consultant to them, or a grant maker network referred the consultants to them. So it was all really about networks. Either the person had already done work, or they came directly to them through somebody that they knew. New York-based funders were more likely than the national group to have cited a grant maker and a grant maker network as being a means of referral for identifying consultants. So how satisfied are funders with their consultants that they work with? Well, it's a love fest, okay? These funders were very, very satisfied. We asked questions on satisfaction related to quality of work, to level of engagement, to timeliness of deliverables, impact of the work, cost, and for no question did satisfaction levels dip below 80%. Okay, so 80% or more funders said that they were satisfied with the work of the consultants that they engaged. However, there were interesting differences in the levels of satisfaction based on foundation size, where larger foundations tended to be less satisfied than smaller foundations in the work that consultants did for them. But again, I'd have to caveat that it's relational because still, even with the larger foundation, satisfactions never dipped below 80%. The one thing that especially found interesting was that one of the bigger gaps between the small and the larger funders was satisfaction related to cost. Okay, you would assume that the larger funders have more resources at their disposal and therefore cost wouldn't necessarily be an issue. However, it was an issue, and it probably speaks to the types of consultants that larger funders tend to engage in. They tend to engage with some of the bigger firms and the bigger groups that tend to be bigger ticket consulting engagements. So, again, this is just my, kind of own interpretation. This is not what was cited in there, but that's probably a reason why we're seeing some of the differences in satisfaction related to cost. And just in terms of New York-based funders, particularly the larger ones, tended to be more satisfied with their consultant engagement than the national funders were overall. And so that kind of gives just an overview of the quantitative data that we collected as part of our survey. What we also did was we asked people to provide open-ended responses provide open-ended responses related to the benefits and the challenges with working with consultants. And I think, this part will give a good segue into what Hilda and Aida would talk about. And so starting with the benefits, 3 big areas that came out were, really having the external expertise, having people who really are commanding, the information and knowledge that doesn't necessarily exist within a foundation. They saw that this was a huge benefit of engaging consultants, being able to bring in this external expertise for the benefit of the foundation. Second was that by getting consultants that are experts in what they do, then that leaves your staff, the foundation staff, to do what it is that they're expert in doing. And so, this whole being able to separate and delineate out roles in a way that maximizes the skills and competencies of people was another big benefit of using consultant. And then last but not least, this whole notion of being able to get a fresh and a neutral perspective to help inform the foundation's work was the last kind of theme that we heard in the open-ended responses. And then in terms of challenges, one major challenge was the work that it takes to get a consultant up to speed. A lot of funders cited there's a lot of front-end work that in order to get a consultant to really understand not only the project, but understand the foundation and the context within which the work is happening, you have to invest that front-end time. And so that's one of the challenges that some people tend to underestimate. And so folks highlighted that. The right consultant tends to be a challenge. Not every, different people have skills and competencies and strengths in different areas, and the importance of finding the right person to meet the foundation's need could be a challenge. Ensuring sufficient engagement. There was, some comments just related generally to, once a, consultant comes on board, how do you ensure that the foundation's getting what they believe they should get from that consultant, and vice versa, in terms of the relationship. And then last but not least, knowing what you're getting into. Again, I think there are a couple of other papers in the foundation review that speaks particularly to this notion of knowing what you're getting into, which is both in terms of the consultant and the foundation, really understanding, okay, what is that you're asking for? And then once you're in it, how does it need to either evolve or change, or what type of management needs to happen, or just, knowing probably that how it was laid out at the beginning is not how it's going to turn out at the end, but just this whole notion of trying to anticipate what the work is going to look like moving forward. So with that, I will transition it over to Hilda? Paul? Oh, transition over to Paul, who will then introduce Hilda. So thanks, everyone.
Thank you, Brenda. Again, after all three of our presenters speak, we're going to open it up for questions and comments and so forth. So our next speaker is Hilda Polanco, the founder and CEO of Fiscal Management Associates, otherwise known as FMA. And FMA is a national consulting firm with offices here in New York, Chicago, and San Francisco. And I know Hilda herself is recognized as a leader in the field. She and her colleagues work to build the capacity of both nonprofit organizations and philanthropic organizations. And Hilda will speak from the perspective of someone who's out in the field doing the work of philanthropy consulting. Hilda?
Thank you. Thank you, everyone. I have allergies, so I apologize for any coughing. As I read the article, and I encourage you to read the entire issue, it's fascinating. I reflect on the fact that foundations, philanthropic organizations, are really businesses themselves. And as we advise them, we're really advising a business enterprise. And the work that we do at FMA is heavily balanced in the area of the relationship between the foundation and the grantees, and helping the foundation in their grant-making process. And so there's this helping the organization determine that conversation that needs to happen with grantees, whether it's around evaluation or marketing or communications or technology, any of the things that were mentioned. They're actually running businesses as well as becoming advisors to grantees. So in helping the philanthropic organizations, we come to the realization that they engage us for expertise, but they themselves have an expertise, and their expertise is program usually. So they are content experts in their field. They did not necessarily have expertise in these other areas that were mentioned. So the work that a consultant can really play is, or the role that the consultant can play, is really understanding what are those best practices in these areas. So it struck me when I saw the top three, right? Technology, communications and marketing, and evaluation. As we work with different organizations, we get to see best practices. And when we see the strongest relationships, which were cited also in terms of why you hire a consultant, we see the strongest relationships is when that consultant is saying, this is really a best practice. We think this is really a good idea. And then sort of sharing those ideas with the other foundations. As we travel across the country, I'm amazed at how often a foundation will say, well, what are you seeing somewhere else? One example that I find fascinating is this whole concept of restricted funding and investing in unrestricted resources and investing in grantees. There are many examples where foundations are starting to think about, well, maybe there's a way to invest in reserves rather than investing in endowments, which is really not the answer for everyone. Even the largest foundations we work with are fascinated about this idea and want to hear more. So who's doing this and how are they doing it? So I encourage all of us to think about what's our area of expertise. What are we learning in our daily work that we may take for granted as this is just what we do? How do we package that information and communicate back to those foundations we're working with to say, here's the latest that we're seeing in technology. Even though we may not be technology experts, we get to see that. I was also struck by that the best predictor of whether a foundation would engage a consultant is whether they had engaged them before, or whether a friend in another foundation had engaged them. So it's all about relationships. And in our work, professional services, we have found that you build those relationships over time, and that role that you play, again, in bringing that expert advice is a really strong part of that relationship. When it comes to this area of how do you help a foundation build its capacity, we think of capacity building primarily working with grantees. But in fact, all of us, when we work with foundation clients, we're building their capacity to do what they do better. And in the way that we do our work, there's this balance between theory and practice. When we work with foundation staff to help them develop their skills around financial due diligence, the most successful engagements are when we actually hand them a tool that beyond our presence, they can then go on and do what they do and do well. So it's not just sharing those best practices that I mentioned, but think of how your expert advice can be live beyond the engagement to actually arm them with the tools that they need. And as oftentimes there may be this hesitation of, well, if I build the tools, then they won't need us next time. That's actually, I've seen the total opposite. When you build a tool and you make them feel like you've not only taught them a concept, but you've given them a way to work on it themselves, they're happier to bring you back the next time because they know that it will be beyond the engagement. And so I encourage, again, all of us to think about what role we're playing in that and think about what we can contribute in terms of sharing our knowledge. I'm going to turn it over to Paul.
Thank you, Hilda. And let me also add, I'm pleased to mention that Hilda, along with Dara, who you heard from earlier, is also a member of NNCG's steering committee, and NNCG simply could not do the work we do without the commitment and the effort of our steering committee members. So I want to be sure you know both Hilda and Dara are invaluable members of NNCG's team. Finally, I'd like to introduce Dr. Ida Rodriguez. Dr. Rodriguez is currently Professor of Professional Practice and Chair of the Management Programs at the New School's Milano School of International Affairs, Management, and Urban Policy, not far removed from where we are right now here at Philanthropy, New York. And just as importantly, Dr. Rodriguez is former Deputy Director of the Equal Opportunity Division at the Rockefeller Foundation. So what she brings to the conversation today is a perspective of a funder, someone who has been inside philanthropy. Ida?
Sure. It's a real pleasure to be here and to see some people that I haven't seen in a while. Dara knows about the foundation as much as I do, and Yvonne I haven't seen in a while, so this is wonderful. I actually am, that bio is really old. When Paul asked me for one, I was grading and I couldn't find one, so he took it off the website. I actually am a trustee of the New York Foundation, and I'm actually a board of directors, on the board of directors of Hispanics in Philanthropy, which is Council on Foundations affinity group, but also a grant-making entity. So I'm not just speaking from my experience 15 years ago, because it's been that long, but also current experience. And I also teach philanthropy every spring to a bunch of really challenging graduate students. So I'm bound to have to read something on occasion.
The questions that were posed actually in the agenda, big agenda on the website, one of them was, what's the best ways foundation staff can utilize consultants? And I thought back to how Rockefeller, Hispanics in Philanthropy, and the New York Foundation, or the Rockefeller Advisory Fund, which I worked with, how they used consultants. And I'll quickly divide it into 4 different categories: contracting with individual consultings, giving a contract to technical assistance providers to assist grantees, or giving money to grantees to hire technical assistance providers. 3, hiring senior experts on retainer, so you have them every month, a few days. And 4th, using honorariums to individuals or groups to let the officers focus on other things. So those are 4 big categories, and I'll just give you examples. At the Rockefeller Foundation, and I was there for 15 years. I went through 3 presidents, left just before Judith came in, because as Darren knows, we go through a cycle. I still say that. When they're too young, stay too long. When you're at the foundation, you see the difference. Every few years, you have a corporate president, then you have a president of a university, so you go into this sort of softy thing, and then you go back. So we were going back to the corporate, and I just didn't have the energy to pump up for that, and I didn't want to travel anymore. So here I was, and the new school is great. I'm really happy. But I've noticed that the Rockefeller Foundation is not different from what I learned about large foundations now. The foundation has changed significantly, but the practices are similar. One thing we used individual consultants for was a very specific product, if they had a specific expertise. An example, because I loved it when I got it, was a guide for employment programs serving people with drug problems. Very specific. 4 people wrote this who used to be at the Corporation for Supportive Housing. They did employment programs. I knew them because we funded that. They were now consultants. This was a really useful report. We hire them to assess an evaluation design that we have put together. See, foundations worry less about assessing grantees than assessing their own brilliant big ideas. Large foundations always have big ideas, really big, like incredibly big. And then you have to put it into practice, which is what the officers do. And then you go, okay, did I do this right? And then you call in a consultant to look it over. I'm an evaluation expert. That's where I did my PhD work. I was very lucky to have been trained by really like the gurus in the field. I never did that. When I came to the foundation, I always saw the work, which is kind of strange. I'm now teaching practitioners to be evaluators. I believe it has to be owned by the nonprofits. This whole neutral, get an external evaluator, I'm not going for that. I think people that care about the nonprofits most, the people that work on it, and they want to know the problems. So we could talk forever about that, but we do need evaluation expertise. You no longer have the large-scale government demonstrations that used to train evaluators in universities. So where are the evaluation people being trained? And that's why there's such a need. Foundations need that help. Senior faculty recognize names to serve as advisors to large demonstrations. At one point, we had this thing called the National Community Development Initiative, which was huge, huge. Every foundation you want to know getting together to give money to community development. We need a faculty advisors from all over the country to kind of oversee this. HIP, on the other hand, uses consultants for board of directors strategic planning meetings. It's not easy to facilitate strategic planning discussions with the board of directors, all grant makers, all think they kind of know and have a little power. It's hard. So finding the right consultant is really tricky. So if any of you can do that, by the way, you should let me know, because it's hard to find people. And I no longer do consultancy work, not until I finish my work at the university. Smaller foundations, like the New York Foundation, it's interesting. They don't hire individual foundations, as the Community Resource Exchange knows. The New York Foundation has a contract with them to provide assistance to grantees. They will do a competitive market analysis or something and maybe hire a consultant, but they don't. They don't have enough money for that. So they'd rather just put it in the hands of one organization and let it be. Giving contractors to technical assistance providers, as I said, and fiscal management associates. I'm sure you have some association with some foundations. That's not uncommon. Putting senior people on retainer. You know, there are people like Mike Svirnoff, who some of you might remember. He was at the Ford Foundation, started LISC, MDRC, like about everything. When I met him, he was older, and he was like the most important person in my life because he knew I was young and junior, and we were riding a taxi, he'd give me advice. Well, you put them on retainer, $2,000 a month at that time, and whenever you call them, they're available. Pete Rossi was the same thing, and they still do that now. The last thing is honorariums. You know, if you want to hire, we never wanted to get a neutral perspective. We didn't know that existed. Most foundations are too vain to think that exists. But a fresh perspective we never worried about because we could call in experts to have lunch with us. And everybody would come to lunch, hoping they'd have a connection and get funding. So we never really needed to do that. You'd give an honorarium if you wanted someone to give a special talk to the whole foundation. But that didn't work for us, that whole fresh perspective or anything. What are the challenges? Do I still have a minute? What are the challenges in bringing on consultants from the foundation perspective? One is that you never think of an exit strategy. It's never clearly articulated. So you have this person on retainer, so like kind of when does it end? And you never say that up front because you're kind of in love and you just forget. And then you have, the same thing happens with the other arrangements. It's hard sometimes to get out of them. I read the ethical code, the code of ethics of the National Network of Consultants for Grant Making, and I was so relieved. If that had existed when I was at Rockefeller, my life would have been easier, because one of the things you worry about is trusting the consultants. That's why you hire them through networks, people who know network, people who you funded, because once you expose, the consultant comes in, they become part of the family. You forget they're a consultant. They're in the room, you're talking about like important things that you shouldn't be saying in front of a consultant, unless you trusted them and unless they have a code of ethics that they're following. TA providers sometimes are not what the grantees want, but we think they have a problem. We tell the grantee, you have a problem. They don't think they have a problem. They think they need more money to hire staff. That's their problem. But we impose technical assistance, and we say you have to have it because you really do have a problem. And that gets sometimes challenging. Consultants are the face of the foundation. Once you hire a consultant, especially for places like Rockefeller, the really old, Ford, and those, they assume that wherever you go, you will be the Rockefeller Foundation. So you can't be outside on a Saturday acting too foolish. If it gets on the paper, oh God, that's embarrassing. So there's this thing, there's a different culture between consultants and old, large foundations that you have to really negotiate, and I actually think the code really would help. The last point about a challenge, consultants, maybe as they get more senior, don't have this problem, but they're often very passive. And they often say yes too much, and they sort of seem like they lack confidence. They hold themselves back. I don't know if it's because they want more jobs with the foundation, maybe, or because they don't quite know how to negotiate that culture. But foundation officers are used to being very aggressive. We get our money by fighting every other person in that foundation and the board. I mean, you know, I'm a little tiny Latina, and I got up, and, you know, there'd be all these people that couldn't even hear me. And so I learned to be aggressive. I expect the consultant to show that confidence and not to tell me always, oh, yeah, you're right. Everybody tells me that. I don't need a consultant to say that. I know I'm wrong sometimes. So that holding back, lack of confidence, I think was a challenge. And I just share it because maybe you haven't heard it, or if you heard it a million times, then sorry. That's all I had to say. Thank you very much.
Thank you, Ida, for your especially candid remarks. I think we all appreciated hearing those. So I have just one question before I'm opening it up to the group. So as the three of you reflect on the data from the survey, is there anything you found surprising? And as you think about going forward, is there anything in the data that tells you something or anything about how the field of philanthropy consulting is evolving and what we might want to be on the lookout for over the next few years.
I mean, I'll go first. I would say I was surprised more by how much the data confirmed what we had suspected was happening in the field. You know, like, no duh, larger foundations are going to engage consultants more frequently. Foundations use consultants when they need them. And particularly, because we know this is a field that centers on relationships, the fact that the way that funders find their consultants are either through, already situations where they've already worked with them in the past, or refer through the network. So for me, the biggest surprise was, wow, okay, finally we have data that supports what we already suspect and know. The one thing I would say, maybe if we had the opportunity to dig in some more, I would like to understand the big difference between the extent to which community foundations engage consultants as opposed to the corporates and independents. That was somewhat surprising to us, that there was such a large difference between community foundations and the rest of the sector. Although maybe it also makes sense, because community foundations are a different beast. They have to, raise funds. And so it makes sense that they're engaged in activities that the independents and the corporates don't necessarily need to engage in. So, with that, I
wasn't surprised, but I guess I am surprised. We continue to have no way to find consultants. It's via a network, this network, which is why I hadn't heard of your organization, which is shocking to me, but now I hear you just came on not too long ago. Because you need something like that where you can go and get people that you would never have met through your network. For me, I grew up, I'm 60. I'm at the age where I identified myself as Latino feminist at one point in my life. I was telling them this is the first time I'm on a panel with Latinas and we're not talking about diversity. It's like fantastic. Miracle. And so my point is that people of color can't access these networks, and a lot of people can't access because foundations are very secretive. I bumped into one through a faculty member who threw me that way when I was 28, but it's very hard. So it just keeps coming up in every survey. You talk about consultants. I get calls all the time, do you know an evaluator? And I'm like, huh? There's millions of people in New York City. You want to know if I know an evaluator? And to be honest, I don't know too many independent, small evaluation firms or evaluators that I know well enough to recommend. So if we had something like this, it's great. And if you divided it by evaluators, because, foundations and people who are funding entities worry about confidentiality. So somehow somebody has to screen people. So that keeps coming up. I wasn't surprised by it, but it's been forever we've been trying to get this right. So I'm kind of hoping we did now. Thank you.
So first, the community foundation statistic really struck me. I wondered, so there's the donor advised fund, there's the sort of building the community. Maybe that's the reason, so it'd be great to learn a little bit more. And then the other part that I thought about was these three areas. So if you think about technology, there's no such thing as best practices in technology because they're changing as we're speaking. Just when we think we get it right, it'll be different tomorrow. And in evaluation, it feels the same way. Like just when you think you've got the right idea, someone comes up with a better idea. So communications and marketing, maybe less so, but the intersection between communications and technology with social media. So it was interesting to see that those are the three top areas that the foundations are searching for help. Because I think in general, those are the areas where you're sort of grasping at what are those practices. So again, if those are the areas, I think for us, it's thinking about how, even in our own work, whatever it is that we do, how can we be most knowledgeable of where the expertise is in these areas? Because when we are asked for referrals as well, if we know those are three areas where help is needed, how can we help strengthen that network?
Great, thanks. We'd love to broaden the conversation to include as many of you as possible. So if you have a question or comment, please speak. And if so, the live stream will capture you. The mics are at this end of the table now. So who's ever ready to speak, just grab it. Kind of repeat your name and again, so we remember, and people online as well, and go for it.
Okay, thanks to all four of you, excuse me. I'm Deborah Flood with Penn Flood Consulting. I had a question. I was interested that the survey excluded the hiring of consultants to work directly with grantees. And so two questions. One, just to clarify, you mean in the cases when a foundation hires a consultant directly to work with their grantees, or did you mean, okay. So we have in our firm, one of our larger clients has asked us to do a lot of work with their grantees and is hired us directly. And the interesting thing is that the work with these grantees is very similar. I mean, it's just like our work with other nonprofits. However, what is sort of the byproduct of that work is deepening of the relationship with the funder, but we find that as they've gotten to trust us, that their asks of us which are not built necessarily into the contract, then we weigh in on their strategy, so it's very indirect. Like we find that sometimes it's an indirect way of having us feed into their grant-making strategies or overall strategies. And I don't know how common that is, but my sense is that it's particularly since strategy development was not a big area where foundations are using consultants, that this is fairly typical. And I'm just curious to hear from others in the room if you're seeing a similar thing, that what you're hired to do. I mean, certainly we do what we're hired to do, but sort of on the side and the communication with the funder, there's a whole other level of kind of advice and consulting that we do that's not necessarily directly in the contract. So. Anyone want to respond?
You can pass the mic down.
As I look at Katie directly, anyone want to respond?
Hi, Katie Lamberger from CRE. So we see this a lot at Community Resource Exchange, and we see it both with foundation funders as well as government agency funders. I was actually saying to Hilda as we were traveling here from another meeting that we're seeing increasingly with a lot of the government agencies that fund us to provide capacity building to their nonprofit providers, that they're then seeing what we're doing with those nonprofits, saying, hey, can you actually do that for us? And the difference is they will actually contract with us to do that as well. It's not just like an add-on to the work that we're doing with them, but we see it a bunch. And I think another question, if I can ask you guys, I'd be curious to know for the report itself, or maybe the questions and some of the data that came out of it. So it sounds like there was a look at how do foundations engage consultants to do work directly for them, and you did not look at so much what we were just talking about, where kind of the consultants are doing work for the grantees. But did you get any information on, even just anecdotal, how many foundations, or if so, what types, are looking at consultants as a good partner to really facilitate and engage their grantees in a conversation around how to improve grant-making practices, or what does it really mean to measure impact, and how can you do it in a way that's really about the learning process for the organization? Like, was that explored at all? And if so, I'd be curious to know what came out of it.
Yeah, so being a good researcher, you always look back and reevaluate whether or not the survey that you administered was the one that you wanted. And when I looked at why we didn't ask the questions on grantees, it didn't make any sense to me. Like, I wish we would have just gone ahead and included all types of consulting and just made, support to grantees just one of the options or the types, in addition to the legal and the financial, because I think we probably missed out on some of this rich information in terms of exactly what it is that funders are asking for consultants to support grantees in. So that's, again, maybe 5 years from now we'll ask that, and we'll be able to add it in there. But unfortunately, we don't have any information on how they're engaging with grantees and whether or not they're doing the types of things that you're asking about, which is getting feedback from grantees to help the foundation strategy. I would say probably the one entity within the field that's been doing probably gathering some type of this information like this is Center for Effective Philanthropy, with their, grantee perception reports. That's probably the best that you'll get to getting some type of understanding. And the extent to which funders make those reports public varies, from funder to funder. But I think that's probably the closest place that you can get some good information on that.
My experience within the foundations, I sit on the boards and those that call for advice, is that there's a real push for accountability and transparency on the part of foundations. Even the largest, Congress can close that completely much by changing the legal tax incentives, and they've been threatened many times. The Center for Effective Philanthropy is, of course, great. Foundations, I've pushed foundations to please get the grantees to tell you what they think, and the first reaction is, why do we need to know that? They seem happy. Literally, it's a weird thing. And so I think what the Center for Effective Philanthropy does is give you measures, but it has to be another way, because they're very worried about it, but they don't know how to go out and get the information, so they're all doing it in-house, creating their own sort of measurement tools and the like, and they don't really know how. So it'd be interesting if consultants got together and kind of did this for funders about exactly that topic, because they're all worried about it, but they don't want to make it clear, and yet they need help.
If I can just add to the comments here, one of the challenges when you work with grantees paid for by a funder is who's really the client. Mm-hmm. What do you do with that relationship and the confidentiality? One of the things we've done is we've developed a three-way agreement. So the funder agrees to do these things, the grantee agrees to do these things, and we agree to do these things. And one of the very clear statements is that in working with the grantee, we hold their data in high confidence. And if the funder wants to understand how the project is going, we'd be happy to. But our project cannot be used as another due diligence tool. Right. And that's a really hard line to walk. So any of us that agree to do that work, we have to keep that. And I think funders respect that. It's just a question that needs to be addressed pretty directly early on. So I just wanted to.
Really important.
Mm-hmm. Great. Barbara.
Hi, Barbara Greenberg, Philanthropic Group. I guess I'm also struck by the community foundation numbers, especially if you're not including technical assistance to grantees, which I would have guessed would be an enormous way that community foundations would have used consulting. So if I read the article, am I going to understand more about that? Or
yeah, unfortunately not in the article itself, because all we did was we just separated out the numbers based on foundation type and size, but we didn't then do a subset analysis within community foundations to then see what the practices were. It just, the article was really a high-level national overview and picture of what's happening, but we didn't have time within the article to kind of dive deep and see what was happening with the community foundation sector. So you won't be able to find that information in there. Yeah.
And then if I could ask a quick question also. I was amazed to see that the three kinds of consulting that were most common were IT and communications and evaluation. Was there an opportunity for a foundation to say that they were getting consulting for grant making or grant making strategy?
Yes. So let me just open the paper so I can pull all of them up for you. Yeah, so I guess the closed-ended responses that we provided included the top three. Funders also stated they got support for facilitation, strategic planning, program development, foundation management, grants management, HR, governance, executive coaching, training. Those were all of the options that were provided.
Excuse me. So I just wanted to know, did you see any trends? Is the field growing? Has it been the same for the last 10 years? I'm just curious because I'm very new to this, and it was completely for personal reasons that I started. It was kind of an interim plan, but then I got curious and met a bunch of wonderful consultants. So is the field growing or has it remained the same?
As it pertains to the data that we collected, I mean, this is the first type of study that's been done on the field related to philanthropy consulting. So I would say this is probably the baseline and gives us a quantitative picture of what's happening. And so again, 5 years from now, it'd probably be a good idea to field this again and see kind of whether or not we're seeing any shifts and changes, and whether or not the reasons and the types of services that funders are looking for support on change. But at least quantitatively, this is the only data we have, and right now that's baseline. Okay.
Can we get the microphone down that way? Great.
Actually, to her question, I was just wondering, so Paul or Dara, do you all have any information from NNCG? I don't want to say it incorrectly, so. Do you all have any data about whether or not increase, decrease?
No, as Brenda said, and I've only been on board 7 months now, and then, so Dara might be able to speak, or Hilda, better than I can, but my understanding is this is a groundbreaking survey. No survey about philanthropy consulting had ever been done at the Foundation Center step forward a year ago to do it. But let me ask Dara and then Hilda if there's any other data preceding the survey that NNCG has access to that might respond to that.
Yeah, it's a great question. And I think the answer is somewhat similar to what Brenda described earlier. We have an intuitive sense that the size of this universe is expanding, but we don't really have data to help us kick that tire. So at NNCG, we're constantly thinking about the role of consultants, how to reach consultants where they are, how to build community and a network among consultants, but we don't really know what that universe looks like. And yet we have an intuitive sense that it's expanding, and that the nature of consulting and the role that consultants are playing in the field is rising in importance. And I think sort of gave rise as well to the impetus to conduct this research too. So.
And what I would add to that, just from my experience over 7+ months now, is I've talked with a lot of our members, new members. We've had almost 30 new members since I've been on board, as well as continuing members. I'm struck by how many of our members have indicated they're just, as we heard earlier here, they're just beginning the next phase of their career as a philanthropy consultant. So that would suggest as well that this is a growing field with new people entering, almost on a regular basis. Hilda, do you have any information beyond that?
No, I really don't. I think you covered it.
Okay.
No, that's actually kind of the kind of information I was looking for, like increase in membership numbers, decrease in membership numbers. Since this is the first study, I was just wondering if you had any.
Membership is definitely increasing, and again, a lot of it seems to be people coming into the field for the first time. Ashley, you had your hand up, and then Richard. So Ashley, and then Richard.
As we pass the mic to Ashley, I would say, one of the things that we're seeing shifting in the sector is that now regional associations are allowing consultants to become members of the regionals, and so that seems to be signaling a shift. It may be a shift in terms of the increased presence of consultants and support, but that didn't exist just 5 years ago, I believe. So that's, I think, something that speaks to a trend that's been happening, or in response to a trend that's been happening.
Hi, I had a question, or sort of a response, and I'd love to hear from the group on this. Aida, to your point about too often consultants hold back, and I guess I would say I've had mixed responses. I've been doing this now for 11 years, and I have certainly had occasions where we have not held back, or I've been fairly directive, and it has not gone very well. And I've had experiences where I think people were expecting us to be more prescriptive, and were disappointed that we were not, telling them what to do. And so I guess what I have learned over the years, and I'd love to hear from others on this, is that you really have to know your audience. And I think there's a real, the culture of the organization, but there's a real difference between, for me, when my client is staff versus when my client is board. And I'm often able to be fairly candid and directive with my staff client. But ultimately, when my big client is the board, a lot of my work is really how I can get this group of people to get them to think that they're coming up with the answer, when sort of machinate that arrangement so that they feel they're coming up with the right answer, and not kind of spoon feeding it to them. So I guess I just wanted to highlight that I think there's an art as well as a science in how directive or prescriptive we can or should be with clients, because it really depends on the client in my experience.
Barbara has a response to that.
And as we pass the mic, for those who haven't had a chance to read the special issue yet, Barbara Kibbe with Bechtel did a great piece called Both Sides of the Equation, in which she did qualitative interviews with, I think it was a dozen individuals in the sector who had worn both foundation and consultant hats. Some were currently consultants who were former foundation execs, and then some were foundation execs who were formerly consultants. And it's a really, really rich piece that speaks to actually the issue that you're bringing up in terms of knowing who your client is, this issue of trust, Ida, that you brought up. And one of the pieces that she talks about here was the importance of having a consultant engagement on a burning platform, which just really spoke to me that consultant engagement is only going to be successful if it's something that the foundation actually needs. But she provides some really, really rich stuff in here. So if you read no other paper, even mine, I would say read hers because it's really good, really, really rich.
In response, I think that you're absolutely right. It's interesting. What you're saying is there's an art to how you provide the information. But you still must provide the information. And some people just say no because they don't know the art. And it's just easier. So yes, if you get to the point where you know how to do it, you should at least be aiming to provide the information, because without it, foundations just make so many mistakes. So I won your card because you seem to have learned that.
Yeah, I would agree that this Barbara Greenberg, I would agree that it certainly is an art form, but I think in response to what you're saying, one of the ways to deal with that art form is to provide the client with viable options so that the client can then see the pros and the cons of each option and choose the one that fits best for them. I mean, my choice of the first option may not be the best one for the client, but I think it's about options.
Okay. A response or another question? Okay, and then Richard, you have a question or comment.
Barbara Krasny, I think it also speaks to one of the challenges that was brought up, which is fit, because I think culture is very, very important. And I think different consultants and different consulting firms have different approaches. And I know we at Krasny Plows are very much looking at working with our clients. We see them as the content experts, and we're there to help them come up with the best solutions to their problems. We're not, helicoptering in and delivering the tablets from the mount. And I know that makes some potential clients very uncomfortable because they're looking for somebody who's the expert. And we've heard expert used a lot today. And if that's the case, then we know right off the bat that it's not going to work. But if they're looking for a partner who together can help them figure out their path and to make the best and most informed decisions possible, and highlight the options and talk about the unintended consequences that they may not see from their particular perspective, then we're the right, client consultant fit.
Great, Richard.
Just a couple of points. One about trends in the field. So, as some of you might know, because this is a fun fact, there's 143 medical schools in the country. So if you don't get in, you can't be a doctor. And if you don't have a law degree, you can't be a lawyer. This is a business unlike those in the auto business. There are no barriers to entry. You can leave your job on Thursday doing anything and be a consultant on Friday. And what I've seen over the years in terms of trends is that everybody that leaves the foundation world and many senior nonprofit jobs and people who were thinking about retiring, maybe could afford to retire, decide, well, I want to keep my foot in the game. I want to keep my, if that's the right metaphor. Anyway, I want to stay active. I want to do something. So they hang out a shingle. And frankly, people who've hired me over the years, or my firm over the years, when they left their jobs, all of a sudden they were consultants. And it's fine. And there's businesses all over the place. I mean, I'm not complaining. I'm just saying that it's a whole different landscape out there of not independent consultants who wanted to be consultants when they got out of graduate school, but independent consultants who decided they wanted to do it when they were 62 or 68 or 71. So just an observation. The other thing is, I was just thinking back about the issue about who pays, whether the client hires the consultant or the foundation hires the consultant. And I have been doing this I was just realizing since the Carter administration. And I have never found it anything but messy. I was a consultant, then I went to a foundation and hired consultants. Now I'm a consultant being hired by foundations. There is no way to kind of figure out at the beginning of an assignment how messy something can get or how to avoid the pitfalls of, at some point in the assignment, the foundation person or the client, the nonprofit, saying when you're trying to provide technical assistance or capacity building, somebody saying, well, who are you representing? Who is your client? Can we tell you something that you won't tell them? There could be a book of case studies here. It has never been easy, and I appreciate the fact that you have this something that you said was working. Good because it's just really been a continuing challenge over the years.
Any responses to Richard's comment or comments? Hey, we're gonna get the mic down this way.
Molly Penn, just a response on behalf of NNCG, which is that I'm a new member of their program task force, and we're looking at doing a webinar on exactly that issue, kind of the ethical dilemma of that triangulated relationship. And I know Ashley's been in touch a little bit on that. So if anybody has stories they want to share them with Paul or with me, and we'll feed them into the fodder for the webinar.
Great. Thanks, Molly. Any other questions or comments from the group? Okay, well, I'll tell you, I've got a question for all of you out there. Let me put it out. So based on what you've heard today, both the presentations and your own comments, as you think about your work going forward, I know many of you, I think most of you in the room are philanthropy consultants. Some of you are representing philanthropies. Is there anything that you might be thinking about doing differently? Again, based on what you've heard today, as you go forward. Maybe go to medical school. Let's get the mic down this way. Or they're on, oh, there we go. Okay, great.
This is Thaler Picard. I think I'll be explicit about the knowledge transfer. It occurs throughout the engagement, but summarizing it at the close and putting it in a useful tool format, we do some of that now, and I think I'll do much more of that based on this.
Great. Okay, down here.
I think definitely the exit strategy. We have an amazing consultant that we're working with, but I told her, I said, we must be like the client that never goes away. But yeah,
Tell
so
us
definitely.
Again who you're with.
Oh, Yvonne Moore from the Daphne Foundation. So yeah, definitely the exit strategy.
How many of you do evaluation consultancy? I would hope maybe you'd consider doing more of them. It's not hard. It's really easy. I'll send you my notes. But I think it's just not enough of it out there. It's really not.
Yeah, let's just get the mic down there so everyone can hear.
I've heard the term evaluation used a lot, and I'm really curious how you define it. Because I know it in the context of program evaluation, I know it in the context of enterprise evaluation, and I think it would be very helpful so I can answer your question.
This is Ida Rodriguez, for those online. There are 10 types of evaluations. I mean, I start with the needs assessment, which I think people probably have an expertise in, monitoring evaluation, setting up management information systems, formative evaluation, where you're helping people sort of with the pilot and sort of changing it as it goes. You have implementation evaluation, which is qualitative in a lot of cases. How do you track whether this program was even implemented correctly? Then you have outcome evaluations. So what do we know happened? Did it happen? Also, logic model starts the whole thing. You know, what do you think you're out to solve? What are the activities you're planning? What do you think the outcomes are going to be? And can we all agree on that? That's one type of evaluation work, which I think a lot of you must do. And then impact evaluation, which is where you get into random assignment and quasi-experiments, which is a lot harder for nonprofits. But any of those is what I mean when I say evaluation, and some are much more common in the nonprofit sector, but there's a need for people who can come in, not charge a fortune, and help nonprofits do that. I hope I answered your question. Okay. How many of you provide any of those services?
More hands.
Okay, that's great. That's great. Thank you. That's really good to know. That one has to be very specific.
Yeah, go ahead, Taylor.
This is Thaler Picard again. Since we're talking about relationships and building on sharing knowledge and other consultants, there's a gentleman named Steve Patty who's written a book called Measuring What Matters, and I got to sit in his session at the Four-Acre Summit last month in Anchorage, and I'll be speaking with him in Montana, and he's my absolute new intellectual crush, and I cannot say enough great things about how this guy talks about doing evaluation work for nonprofits and transferring that capacity to the nonprofit themselves to continue doing that work. And I just really rave about him.
Yeah, that's so important.
So again, I just left the New York State Health Foundation. One of the things that I'm most proud of is that we have a workshop 2 times a year where we teach our grantees the basics about evaluation. So they might not come out of it thinking, you know, with a PhD, but they can at least know enough to be dangerous if they have an outside evaluation, or they can start thinking about indicators. They can get some hand-holding from the evaluation team that we hired. I think it's something that Robert Wood Johnson Foundation has been doing for a long time. So I think some of that is out there, and maybe it would behoove some of us who think about evaluation to start crafting workshops that foundations can take advantage of. And
sort of a list within the NNCCG that says we do these services, because I don't think foundation, I know they don't know it.
If I could, one of the things we have online on our website is our complete directory of philanthropy consultants, and you can search by area of expertise as well as part of the country they're working in, etc. So, and again, we're in the process of upgrading our website and looking at making the directory even more useful to the field. So you'll at least get some data now, but do watch this space, if you will, because we'll be adding more to it. Ashley, did you have a comment?
I was very struck by the comment in the findings in the survey that the larger foundations tended to be less satisfied overall, putting aside cost. And in my experience, that rings true. And I think with smaller clients, Hilda, you mentioned this, working with consultants who know how others in the field operate is a huge value to them. So separate from what I may even have been hired to do, the anecdotal, oh, well, so-and-so operates this way, because they tend to be smaller, they tend to be a little less networked, they may not have the same sense of the field and how their peers are operating. So I think one takeaway for me from that finding is trying to really institutionalize or to really build that knowledge sharing into engagement, so it's not just a sort of ad hoc comment like, oh, well, so-and-so does it this way, but really more part of the structure. And we do that certainly to some degree, but I think there are ways to do that across the board, and particularly with larger clients who still, even though they think they know everything, can benefit from learning from their peers, but maybe a little less open to it. So I think that's something we can do as consultants.
Great. Any final comments before we wrap up?
I respond to that comment. I wondered if the larger foundation dissatisfaction, higher level, is because this is about relationships, and in the larger organizations, you have many more stakeholders on the foundation side to keep happy, or just many more relationships to manage.
Okay. Brenda, any final comments from you?
No, I mean, I want a lot of your cards. I mean, because I sit in a university and a lot of the students ask if anybody really believes that they can do. I'd love to have your card because I do get asked, and Hispanics in Philanthropy, and people just don't know what you're doing. And I think the national network now will be really helpful. But it'd be really good that I don't know what you can do, but it has to be out there. Thank you. This has been great.
Good night, everyone.
Okay, a couple of things to wrap up. Just a reminder, the foundation review issue is online. Every article, including the one that speaks to the survey, is open source, meaning you can watch it at no cost. And also picking up on what Molly said, NNCG has a monthly webinar series between now and January. Every article in the issue will be the subject of one of the webinars, so please go on our website and look at the schedule for that. We'd love to have any of you, if not all of you, participating in those as well. And we'll be doing a couple of other webinars, one of which Molly mentioned during this time frame as well. Also want to thank Philanthropy New York for the opportunity to be with you today. Aditi and Anna made this program happen behind the scenes, so let's give them a applause. And let's show our appreciation to each of our three very distinguished and informative panelists as well. And Aditi, I believe you have some closing comments. Great.
Thank you.
I gotta run. Great.
Thank you. Oh, thank you.